Hi, good morning, and thank you for joining us today for our Spring Clean Your Meds webinar here at Essence Healthcare. I'm Jen Wirick, the Vice President of Clinical Pharmacy, and I'm here with Kelly Summerfield, our Director of Pharmacy Operations. Kelly and I are both clinical pharmacists, and part of our job is working with providers, members, and caregivers to make sure that you understand your medications and are getting the most benefits from them. During our time together today, we're going to share tips on how to manage your medications, as well as review some frequently asked questions, real life challenges, and share some key insights about medications that might surprise you. So since today is 2 days before National Prescription Drug Take Back Day, which is April 25th, coming up this Saturday, this is a great opportunity to declutter your medicine cabinet and safely get rid of anything you decide should belong in your discard pile.
Before we get started, just a few quick housekeeping notes. The session is being recorded and we'll share a replay after the webinar. Your microphones are muted, but we encourage you to submit questions if you have them at any time using the Q&A feature at the bottom of your screen. We'll answer as many questions as we can towards the end of the session. You'll also see messages shared in the chat throughout with helpful links and reminders, so feel free to pay attention to that as we go. You'll also see a poll pop up shortly, and we'd love for you to participate. And just as a reminder, today's session is just general education. We're unable to provide individual medical advice, but we'll share some tips and some guidance on when it might be appropriate for you to talk to your own pharmacist or doctor.
That's a lot of housekeeping stuff. So we'll review some of it as we get into the Q&A later in the program as well. So let's go ahead and get started.
Yeah.
As clinical pharmacists, we understand that your medication needs might change over time. Medications get deprescribed, doses get changed, symptoms come and go, and medications may be added. But one thing that probably most of us don't do is keep our medicine cabinet up to date. And it likely becomes more of a dumping zone for all of that stuff that you're currently using, maybe used to use, or thought you might want to use. And that is how we get an overabundance of expired medications, older prescriptions, and duplicate over-the-counter products, or just kind of a mishmash of things that we don't use anymore. So those things can quickly clutter your cabinet and leave you not knowing quite where to go. So while it seems harmless that you might have these extra things in your medicine cabinet, it can cause some risks, as you might unknowingly take something that's either expired or isn't right for your conditions anymore. Many people don't realize that there are dangers in taking certain medications together or using them past their expiration date. Did you know, Kelly, that over 30% of hospital admissions in older adults can be related to adverse drug reactions? Often these are linked to falls, memory problems, and changes in alertness.
That's a pretty high number. I personally wasn't even aware that was that high. So I think that's really important point to think of as we talk about going through our medicine cabinet. And if anything Jen has mentioned sounds familiar, just we want you to realize that you are not alone. We hear this from our members, from caregivers all the time. And today isn't about judgment, and it isn't about perfection. It's about taking simple, proactive steps for your health. Cleaning out your medicine cabinet is one of the easiest ways to assess what you're taking, to identify any potential risks, and to avoid any potential side effects. By the end of this session, our hope is that you'll know what to toss or get rid of, what to review a little more closely with your doctor, and how to have those conversations with your doctor if you do need to review any of your medications. Our goal is to help you feel confident and in control, which could help to reducing the number of medications, both currently that you're taking and that's in your medicine cabinet, and lessening any potential side effects, and just ultimately feeling better and in more control. Before we continue any further, we'd love to hear from you. Please take a moment to answer the poll question that's going to appear on your screen. When was the last time you took an in-depth look at your medications?
Oh, this is going to be good.
Please be honest.
If it's anything like me, I don't know. I can't remember. Maybe a year ago. Maybe if you can't remember, you put over a year ago. I don't know.
It'll be interesting to see.
Right? Make sure you get your answer in. I think we're getting to the end. What do you think? Let's see.
I don't know. I think sometimes we don't realize, like, we think we might have done it, but we can't
Right?
remember.
Oh, look at that. Within the last 3 months.
That
Yay,
is
yay
great.
to those people. Impressive. For those of you that are over a year, I can't remember, you're in the right spot. And for those of you that are on it, way to go. You get a
That
gold
is
star
awesome.
to start the day. We will have some other tips and tricks for you, so don't leave us. Stick around. So we are going to take a look at a patient's medicine cabinet and try and share with you some examples of what we as pharmacists commonly see when we're helping members or caregivers review medications at home and how to most efficiently review your medications. It doesn't need to be some process that takes a really long time. We've got some tips and tricks for how to separate your medications and most efficiently get through it. It is important to know as well, if this still seems a little overwhelming to you, you can also bring your medications in to your pharmacist or your doctor and have them help you go through it as well. If it seems like maybe it's just a little bit extra that you're not sure about. So before we start cleaning our medication cabinet, let's talk about how to store our medicines. We should have had another poll. Where do you store? Because I think the majority of people I talk to store them right in that medicine cabinet that's right in their bathroom. So that actually is not the best place to store your medications. For medications that don't require refrigeration or special storage, a cool, dry place away from direct sunlight, usually maybe a cabinet in the kitchen or a hallway closet, maybe the top shelf, somewhere away from children and pets, but somewhere that's still accessible to you so that you remember to take your medications as well. You want to avoid humid areas like your bathroom. And also storing in the car is not the greatest idea, especially as we come up to summertime. In most places, it's going to get a little toasty, and you wouldn't want your meds in your car.
For sure. And just to add to that, Jen, I know like the humidity and the heat can affect your medications, and if you think about like capsules and they're plastic and they can stick together, so then you've kind of ruined your medications if that occurs.
And just have a mess, right?
Very, very true.
Those would be a remove pile, then is where those would go. So now the best way to start is to go to your cabinet, gather all your medications. While you have nothing in there, clean it out. It's always good to get kind of
Fresh
the
start.
dust. Yeah, start off fresh. And you're going to want to create kind of 2 piles, sort of like spring cleaning your closet as well with clothes. You're going to want to create a review pile, a remove pile, and a refill pile. And so we'll talk about what kind of makes sense to go in each one of those piles as we go through. So we're going to first take a look at current medications. These are the medications that you know that you take or you think that you take. And they should be the easiest ones to start with, because if you're taking good care of your medications, you should also have a current medication list. That's also important. So you have that to take with your doctors. So you have that current medication list with all your current bottles to be able to check and make sure that everything that's on your list is what's on the bottle, and everything that's on the bottle is on your list. This is also a great time to make sure that the directions for use that are on your label also match the directions for use that are on your list so that everything is matching. So as we look at a medication, this is our current medication here. I'm sure a lot of you have these bottles at home. The first thing you want to ask yourself is this medication working for me? Is it causing me any side effects? Is there any questions that I have about this medication? And so if you have questions or you're not sure about certain things, or you're having some side effects that are just kind of lingering or making you uncomfortable or causing you concern, then you want to go ahead and put this in the review pile so that you can talk to your doctor about it. It's something you should still keep currently taking if it's on your current med list, but something that you want to have a conversation with your doctor about to make sure everything's working as it should.
Yeah, and Jen, I'd just like to add on that as you're going through, if you're looking at your bottle and you just think, I'm not really sure why I take this medication, that's also a good time to review that with your doctor, just to confirm that the medication's still appropriate, why you're taking it, and that it's working for you the way that it should.
Great points, Kelly. Yeah, we want to make sure if it's going in your body, you know why.
Yeah.
The next part about your current medications that you want to look at is on your label. It will always have for you the refills that are remaining. This one says no refills remaining. So if this is a medication that you're currently taking and you have no refills remaining, even if there's 30 tablets in this bottle, you're going to want to go ahead and put it in the refill pile. And the reason for that is when you have no refills remaining, it means that if you call the pharmacy to refill it, now they have to reach out to your doctor, get an updated prescription so that then they can fill it. And sometimes that can take longer than other times, depending on if your doctor is available, how quickly you need it. So you want to make sure you're just ahead of it and giving your pharmacy a call to request that they giving your pharmacy or your doctor a call to make sure that you have a fresh prescription on file so that when those 30 tablets get down to 5 tablets, you're able to refill it without any problems.
Yeah, and Jen, since you said to stay ahead, I just wanted to make a point. You may or may not be aware that many pharmacies offer automatic refill. So whether you fill your medications for a 1-month supply or 3-month supply at one time, you can check with your pharmacy to see if that's an offering, and then you don't have to worry about refilling that medication every month or every 3 months because the pharmacy will automatically do that for you. And even when you get to the point where you have no refills, then they can initiate that outreach to the doctor to see about getting refills for you. So it definitely eases the process and helps so you don't have to remember every month or every 3 months.
That's a great point, Kelly. I love automatic refills because if our patients are anything like me, it's like I look at it, I think, oh, I should do this. And then, you get sidetracked doing something else. And next thing you know, you're taking the last pill and you have no refills, no anything, and no medication, which is not a great feeling. So excellent point about the auto refills.
Yeah. Okay, since we kind of talked a little bit about current medications, just wanted to take a second, and when we're thinking about current medications, one way that is great to help stay organized is to use a weekly pill organizer. Now, the two that I have here as an example, this one would be for medications that you take 1 time per day. And then this example, there is a morning side and an evening or afternoon side for medications that you take twice a day. So it is really great to help you stay organized. And also, I'm sure all of us can say there are times when we forget our medications or we forgot if we took them. So it's just a great visual reminder. Like if you get to the afternoon or the evening and you were wondering, did I take my morning medications? If you look and they're gone, then you remembered to take them that morning. And we'd just like to add some of our Essence Healthcare plans do have an over-the-counter OTC benefit, and pill organizers are included with that benefit. So it's more than just over-the-counter medications. There's a lot of things that are included that are not just strictly medications.
Yeah, I love the over-the-counter benefit. It really has a lot of valuable things in there. Even things like blood pressure cuffs you can get through the over-counter benefit. So not just for Tylenol
Yep.
or Band-Aids.
Yep.
Um, all right, so the next category, once we've kind of worked through our current medications, reconciled them against our list, decided maybe what we need to review with our doctor and what we need to refill, and put the ones that everything's good with and we're all set back up in our cabinet that is not in our bathroom. We're ready to move on to the next group of medications, which is looking for expired medications. Expired medications are usually pretty easy to find. On the label, it usually gives you an expiration date. Now, something to be aware of is that oftentimes on your prescription bottles from the pharmacy, they don't call it an expiration date, it's a use by date. That would be the same as an expiration date, so you don't want to use it past that date. So like this one is March 20th, 2022. So this also tells me that this particular patient has not cleaned out their medicine cabinet in quite some time. I'm sure we could probably all find something that is a little bit past its prime in our cabinet. So you want to make sure that for this one, if it's not a medication that you need to be taking anymore, that you go ahead and you would just put it in the remove pile. Now, over time, you might think, well, gosh, like I still might need that medication. Maybe I should keep it just in case. But it's really important because over time, medications can lose their effectiveness. And in some cases, there's also safety concerns with expired medications. So you want to go ahead and make sure that anything that's expired that you go ahead and put in the remove pile. And if it is something that is expired, but you think you might still want to take, oftentimes that might be a medication that you take on an as needed basis. So you got it filled and then you used it a little bit and you're keeping it around just in case you needed it again. If it's expired, go ahead and put that in the remove pile, but you could also talk to your doctor if you think it's a medication that you might still want to have on hand or have available for you as well.
Yeah, it's just one thing I want to add to that. Jen kind of walked through on the bottle where you kind of look for that expiration or use by date. Just wanted to point out with creams, both over the counter and prescription, the expiration date can sometimes be a little tricky. And in most cases, it is printed on the very end, it's imprinted here. So that's a good way to identify. And this particular expiration is August of 2024. So this is also past expiration and would need to be added to our remove pile. And as we're talking about removing and tossing medications, we are going to give you some tips a little bit later on the best way to get rid of your medications that are no longer needed or expired.
I'm impressed you could read that. Oftentimes I need to get like a magnifying glass out
Sometimes
because
challenge.
they're a little bit tough. So it is on there somewhere, I promise,
Yeah.
but sometimes it's a little bit of a
and as you roll the tube, as you roll it to get down to get all the medication out, it sometimes makes it even more difficult to identify.
Absolutely. So don't feel bad if you have to grab a little magnifying glass or something to take a look because it can be a little bit tricky. All right, so the next kind of category of medications that we see folks have a fair amount of actually in their medicine cabinet is over-the-counter products. I feel like a lot of times I'll be at the store and think, oh, I don't know if I have this, I'm starting to feel sniffly, I need to get some cold medicine. And there's a really good chance I probably have some at home that is not expired. But I feel the need to buy another one. So I end up with this whole kind of grouping of cold, cough, and flu over-the-counter medications. One thing that's really important about those is they oftentimes are not single ingredient. So if you get something that's like cold, cough, and flu, there are multiple ingredients in it. And for those drugs, many times they include like a pain reliever or an anti-inflammatory. such as acetaminophen, which is Tylenol,
Mhm.
or ibuprofen, which might be Motrin or Advil. Those are some common brand names associated with them. So if you are looking to take a cold and flu medication, oftentimes they come in boxes and are, blister packs. You want to double check on the back here. It'll give you the list of ingredients. Again, a magnifying glass may be necessary.
There's a lot of words.
Or asking the pharmacist to help you read, or make sure it's the right thing for you. You want to make sure that if there is acetaminophen in it, that if you are also taking Tylenol, on a as needed basis, that you're not overlapping the two. So this should always be a review so that you just make sure that what you're taking is okay for you, from your other conditions and other medications, and also that you are paying special attention to those types of medications when you are taking them to make sure that you're not getting too much of one drug if multiple products are giving you the same active ingredient.
Yeah, and Jen, I would just add to that, like we're talking about over-the-counter medications and duplicating those, but oftentimes also, since you mentioned Tylenol or acetaminophen, there is acetaminophen in prescription products combined with other medications. So just make sure you're thinking about that. Like, am I taking acetaminophen already with my as needed or regular pain medication? So you just want to be extra aware so that you do not take too much in one day.
Yes, that's a great point, Kelly. So if you're like me, you probably have a pile of medications that you no longer take, but you might need. I know my parents do this. They maybe had a dosage change or a drug change, and they're hanging on to the other one just in case. And it might not even be expired, but there's a high, not a good chance that they're really going to go back on it. Go through those, take a look, see maybe when it was filled, when the last time you actually used it, if it's not expired, and if it's not something that maybe you want to remove quite yet, at least put it in the review pile so that you can take it to your doctor, have a conversation about it, and then decide from there if you want to discard it, or if it is not expired but was filled years ago. There's a good chance you're probably not going back there. So, and if you do, you probably want to start fresh anyways. So go ahead and then you would just put it in the remove pile. So give yourself a chance to restart and in a refreshed way if at any point in time you were going to need it. And please, above all else, do not give it to friends or family that might also be taking the medication. It really is the best practice to use your own meds for yourself and not share them around.
Yeah, and I think when it comes to old and medications that have been stopped, it's hard sometimes to let go, especially if you paid a lot of money for those medications. And like Jen said, what if I restart? Generally, most often the medication has been stopped for a reason, whether you had side effects, you couldn't tolerate it very well, or it just wasn't working for you and your doctor switched you to something else to treat the same condition. So the chances of restarting an old medication generally are pretty low. So that's why ultimately the recommendation is generally to remove. But again, like Jen mentioned, if you need to review with your doctor, that definitely is also appropriate. But removing those medications just helps prevent accidental ingestion. If you do use a pill organizer and you go grab all of your medications, if one of your old medications is mixed in with your current and then you're filling your pill organizer, then that could be, increased risks.
Great point, Kelly.
So just kind of take a moment to recap what we've discussed so far with current medications, expired, over-the-counter medications, old and medications that have been stopped. Just kind of reiterating what we said. Some medications don't work the way they used to. Some might add hidden risks that you're not aware of. Some might create confusion if you're wondering, what's this for? Why is it in my medicine cabinet? So clearing out these medications and creating review, remove, refill piles helps simplify your cabinet and helps reduce safety issues and risks.
I like it. So we've covered a lot of ground so far. We got a little bit more to go. So hopefully this is helpful. One of my favorite topics next that we're going to touch on is supplements, vitamins, supplements, herbal products. Oftentimes people think they're safe because they are natural, but they can still interact with your current medications and with just some medical conditions that you might have. So it is really important if you're wanting to start an herbal or a vitamin that you have that conversation with your doctor or pharmacist to make sure that there's not anything that you didn't think about and that it's safe for you to start those products. I know there's a lot of them in the aisles and a lot of
very overwhelming.
Yes, and a lot of conversations among friends about different herbals and vitamins and supplements. But it's always best just to do that double check with your physician or pharmacist to make sure it's safe.
Yeah, I definitely agree with that recommendation, Jen, just because there's so many, and in addition to friends and family, there's advertisements on TV, and then you think, oh, is this good for me? Maybe this could help. And so there's definitely potential risks with medications, with medical conditions. So always best to review those before starting on any supplements.
So the last type of medication, which is always a fun one to find, is the mystery pills. Like you've gone through all of this, everything's in its bottles, all of the things are done. And then there's this like one lone pill at the bottom of it all. No need to waste time on that one. Go ahead and that would go in your remove pile. You probably haven't missed it. And that would be the same for any old pill boxes that you might have that have old tablets in them. Not sure how long they've been there. That would go in your remove pile as well. Don't get rid of the box though. You can use it for your current meds.
Okay, so we've kind of gone through all of the categories that you might find as you're reviewing your medicine cabinet. And we talked about those that you need to remove or toss or get rid of. So just wanted to reiterate what Jen mentioned at the start, that this Saturday, April 25th, is National Prescription Drug Take Back Day. There's many pharmacies and community locations that offer safe drop-off locations, and you can literally put your medications in a bag, take them to one of these locations, and they will discard your medications. We're going to provide some information in the chat if you would like to take a look to identify a location close to you that you can take advantage of. We also wanted to offer some suggestions if you do not have the ability to get to one of those locations to discard your medications. We have two ways to kind of suggest to discard your medications at home. First, there is an option to flush medications, but we don't want you just to take all of your medications and flush them down the toilet. That definitely is not the recommendation.
Don't do that.
Yeah. The Food and Drug Administration, the FDA, they actually have a list of medications that they have determined are safe to flush. So if you have medications in your remove discard pile, they are on that list. It's safe to flush those. If you have medications that are not on that list, one way that we recommend is to take those medications out of your original containers, to mix them with an undesirable substance like kitty litter, dirt, coffee grounds, mix them up, put them in a container, whether it's an old plastic container or a Ziploc bag, any kind of container that you can close, and then you can throw that in your trash. So those are just two options if you aren't able to take advantage of the drug take back locations, just so you can still remove and discard and get rid of those medications so they aren't lying around.
Those are great tips, Kelly. I think that's probably the number one reason that I hear from people that they have all these extra expired and unused meds at home is that they just aren't really sure what to do with
What do I
it.
do?
And they don't want to do something wrong.
Yeah.
So there's a lot of resources out there and opportunities, and we did provide some of those in the chat as well. So hopefully that helps you feel more comfortable in getting rid of things as you go through your medicine cabinet. So as we've shared today, medicine cabinet clean out is really an essential part of health and safety that you should perform about every 6 months. So ideally in April and October, especially because April aligns with the prescription drug take back day. So all of those of you on the webinar that said within the last 3 months, like awesome work, so proud, keep it up. And those of you that were maybe over 12 months, maybe use today as an opportunity to kickstart your every 6 month regimen. So we know that regularly reviewing does reduce the risk of accidental ingestion or just misuse and does prevent the buildup of unnecessary, ineffective, or expired products. So it really is a good habit to get into and can align with maybe some other spring cleaning things that you do in April.
For sure. And I think just the biggest takeaway in doing a medicine cabinet review is just to keep it simple. You know, our suggestion is to create the 3 piles, and then you know what's current, what your current medications are, the clear reason you're taking those. Then you have your review pile if you need to review those a little bit more closely with your doctor, anything you might be unsure of. And then lastly, the remove or discard pile to avoid that potential risk or any confusion. And also, I just want to take a moment as we're talking through, reviewing our medications and cleaning out our medicine cabinet. That's something everybody should do individually. But we want to acknowledge that there are oftentimes caregivers caring for loved ones and spouses, family members, and you're assisting that individual with their medications and their administration and keeping track of their medications. So it's definitely something you can use for yourself as well as a caregiver, so that you can help your loved one the same way that you do for yourself.
So really, cleaning out your medicine cabinet can be like a team sport. Really, like get everyone in your house involved. I'm sure everyone's got a few things hiding in random spots, and get everyone can kind of work on their own thing.
Yeah, Jen, one thing that you saying that I think of is, it's great when we're talking about the proper place to store medications, but if you talk about multiple people living in the same house, you each need to have your own designated medicine cabinet because you don't want to just have a community pile, because then that just adds to your risks and your confusion and who's taking what medication. So definitely important to keep those cabinets separate.
Yes, very good tip. And to clean them both out every 6 months. One additional thing that we want to share with you guys as you're working through your clean out is we've included in the chat, this is both electronic, so you can fill it in or you can print it out. If you don't have a current medication list or you think yours could use a refresh, just like your medicine cabinet, go ahead and use this document to fill out. And if you find yourself unsure of what to put in for certain things as you're listing why you take a medication or even how you take it, you could put this in your review pile as well and make sure you take it with you on your next visit to your provider. And then additionally, we covered a lot of information today. And if you weren't a real fast note taker, which is okay, we are going to provide in the email a very nice summary of kind of what we talked about and how to best navigate cleaning out your medicine cabinet. Great spot for this is right inside your cabinet. If you want to tape it in there, then it's a reminder to you to clean it out, and also gives you some tips and reminders on how to do it most efficiently. All right, so I think that brings us to our question and answer section today. Yes. So if you have a question that you would like us to answer, please go ahead and put it in the Q&A section, which is available at the bottom.
For sure.
And remember, if you do put anything in there that is really specific to yourself, we won't answer that here live on the webinar, but someone will follow up with you to help make sure that you get the answers that you need.
Okay, it looks like we do have one question, and that was, can I take OTC meds with my prescriptions? So I know we touched on reviewing over-the-counter medications a little bit. I think one area I'll kind of take this question that we hear a lot is for patients that are taking medications for high blood pressure. And can I take this cold product with my high blood pressure medication? One product that is included in a lot of cold and cough products is Sudafed is the brand name, or pseudoephedrine would be the generic that would be listed. That is one medication that is generally recommended to avoid if you are taking high blood pressure medication, have high blood pressure, just because that can further interact with your medication and increase your blood pressure. And then kind of just to add to that, one point Jen made earlier with OTC medications, they generally have a lot of ingredients, 2, 3, 4. So really trying to focus on what you need. So if you have a cold and you're trying to treat runny nose, then you really just need to focus on the antihistamine component. So you don't want to take a bunch of medications that you don't necessarily need for the symptoms that you're trying to treat. So if you do, if you're trying to treat any cold or flu-like symptoms in the pharmacy, you're overwhelmed, just feel free to, take that medication to the pharmacy counter and ask the pharmacist, because they'll definitely help you navigate all the products that are available.
Even if it's not your pharmacy that you use to fill your medications,
Good point.
They will help you if you need help. So we have another question coming in. How do I get signed up for automatic refills? Oh, that's a great question.
Yay.
Good thing that you pointed out. So automatic refills are available at both retail and mail order. Your retail pharmacy, you can ask your pharmacist to help you sign up, or oftentimes they may have online access, and you can do it at the medication level. So it doesn't have to be for all of your medications that you get. For mail order, you can also sign up for automatic refill. And a great thing about our mail order benefit this year for 2026 is that you can actually get a 90-day supply of medication for a 2-month copay. So really you get that extra month without the extra copay, which is...
That's a great benefit.
I know, it was very exciting to be able to offer that this year. And you can also sign up at the medication level through Express Scripts Home Delivery. When you are signing up for the program, you can also identify that you would like to enroll in automatic refills. And the nice thing about automatic refills is that, as Kelly pointed out, you can get them delivered, go pick them up. You don't have to remember to refill. You can also shut them off whenever you want. So if it isn't something that you really liked and you prefer to have to call in, you can always do that as well. So you're not stuck. So if you're not doing it right now, give it a try.
Yeah. Okay, it looks like maybe another question came in. How do I know what medications I can combine? And I think this question could go a bunch of different ways. So I'll take it one direction that I think of when I read that question. More around timing of medication. If I take multiple medications, can I take them all at the same time? How do I split them up through the day if it's more than once a day medication? So one that we see frequently that I just kind of want to highlight, may or may not pertain to you, is if you take medication for thyroid, levothyroxine, Synthroid, those are common names that I'm referring to. Those medications should always be taken separately, never combined with your other medications, and also not with food. So it's recommended to take that early in the morning, at least an hour before your other medications or before eating. There's also some medications for osteoporosis that come to mind. Fosamax, Actonel, alendronate would be a generic name. There's specific administration recommendations with those that you would take also separate from other medications. And when you think about timing of medications, generally there are medications that can be taken together if you're taking multiple medications. But if you're unsure, again, this is definitely a great time to ask your pharmacist if you're not sure if you should separate any of your medications. And I think the last thing that I'll talk about for timing of medications is there are some that should be taken with food. And generally that will be on your label if that's a recommendation to take with meals. So just kind of pay attention to your label for any special administration recommendations for your medication.
Great points, Kelly, and tips for how to combine or not combine certain medications. It's also something really great if you do have medications that require special use or special timing to go ahead and you can document that in your how do I take it so that you remember every time. So great questions that we had come in. I think that might be all that we have right now. If you have any additional questions, you can go ahead and put them in the Q&A section. And if we weren't able to address them here, we will certainly have someone get back to you so that you can get the answers. And
Okay, so we hope what we provided to you is useful, and you'll be able to take the little tips and tricks and kind of use that as a guide to walk through your medicine cabinet. After today's session, we just asked you pay attention to your email. We're going to send a recap along with the medication list that Jen showed you. Which you can use both of the documents to help you stay organized, whether it be for yourself or for your loved one if you are a caregiver. And we just encourage you to, if you're one of those individuals that wasn't sure, it's been 12 months, we just recommend taking 10 minutes this week to review what's in your medicine cabinet. We just want to thank you again for being here today.
Thanks and have a great day.
Bye-bye.
Bye.